This is something that our president supports strongly on the basis of the question of solidarity, of ensuring everyone is able to get access to healthcare. Now we come to the last part of my presentation, which is looking at economic benefits of NHI. Well, we know that health affects social development and economic productivity, and it does so in several ways. First, in terms of increasing output as a healthy person works more effectively and efficiently and devotes more time to productive activities. Secondly, it helps because it allows for a broader knowledge base in the economy as the gains to education increases life expectancy. If people are healthy, they're able to get education and they're able to contribute to economy. They're able to live longer too. Also, it increases work life and savings. As a result of increased life expectancy, we may result in earnings and savings more for retirement. So if you didn't have to pay so much money that you have to healthcare and you are putting it into retirement, the country will be able to have resources that it can be able to use in order to grow the economy. And lastly, there will be an increase in labor force activity. Now, a healthier population essentially translates into a productive and effective workforce that is going to grow the local business, that will attract foreign investors, and that will grow the domestic economy. I'd like to conclude with a quote from the Secretary General of the United Nations, the then Mr. Ban Ki-moon, at the 2009 UN General Assembly on the theme of advancing global health in the face of crisis, which crisis we are seeing now in the form of COVID. We can cut back, he says, we can cut back on health expenditure and incur massive losses in lives and fundamental capacity for growth. Or we can invest in health and spare both people and economies the high cost of inaction. The cost of cutting back is unthinkable. Investments to scale up basic health services can bring a six-fold economic return. Healthy people have improved life expectancy, go to school, are more productive, take fewer days off work, have lower birth rates, and thus invest more in fewer children. Forward with solidarity, forward with people's power. NHI now. Thank you.
Thank you very, very much, Prof. Well, I do hope that for those who tend to throw around the term policy uncertainty, that this clarity of thought and the way that you have very, very clearly laid out the policy considerations in regards to the funding model will now bring some clarity and sobriety into the perception of this policy. Thank you very, very much, Prof, for that input. And now, without too much further ado, I would really like to invite the Honourable Minister to deliver his keynote address. And I reflect on, or rather, I would like to reiterate the term that was used for the Minister as a tireless fighter. I have been very, very privileged to witness that myself and to have the proximity to this type of leadership. Honourable Minister Kabazela, the floor is yours.
Thank you very much, Dr. Lwazi Manzi. Our Program Director, the Director General, Dr. Buthelezi, the Deputy Minister, Dr. Phahla, our esteemed panelists, Professor Olive Shisana. Let me say as well that if there's any one fighter for NHI that has survived for a long time, is the Professor Shisana. Way back during the days of President Mandela, from the days of Shisana Brumpe Commission, during the days of President Mbeki as well. And of course, for the past probably just 12 years or so, we have had to wage this fight together side by side. And I really do appreciate your courage and your energy and your clarity when it comes to this matter. And of course, you're still continuing within the presidency. So as a presidential advisor, I'm sure the president wouldn't have got a better advisor on this issue than you have than to have yourselves. My brother, Dr. Owen Kalua, the resident country representative from the WHO, indeed We thank you for all the support, and you have been here with us all the time. And you came here on the first day. This was the issue that we're dealing with, and thank you very much. The Dr. Rob Yates, our friend from the Chatham House, indeed, thank you for a very insightful speech, but also your support all the time on this matter has been really quite valuable. Mr. Steve Letsige from SANAC, Dr. Stan Mlwabi from GEMS, and Professor Robbie van Niekerk. All of you, you have really added a lot of color onto the issue of the universal health coverage on this special day. So I would like to welcome all the presentation that you have all made and convey my sincere gratitude to the insightful contribution that you have made for the day. This highlights the importance of commemoration days where we are afforded an opportunity to stop and reflect on the progress we're making towards our goals, even as we are facing an immediate crisis that threatens to divert our attention. But what we all agree on here today is that COVID-19 pandemic can be seen as an opportunity rather than a distraction, to use this crisis as an impetus for accelerating our path towards universal health coverage. Dr. Yates has articulated this sentiment very well, and I must say that we are really convinced that's the way to go in order to be able to ensure that we are ready for the next crisis. We need to take advantage of the current one and strengthen our systems and make them more resilient. This year we commemorate the Universal Health Coverage Day under the theme, Protect Everyone. We find ourselves in the midst of a second wave that seems determined to dwarf the first wave. Therefore, the theme could not be more resonant this time. As we're confronted by the heavy storm approaching us, I must take the opportunity to appeal to the public, particularly our youth, to be fully conscious of their agency and the role they must play to protect everyone from the devastation of COVID-19. We as government have and will continue to mobilize all the state machinery we have at our disposal to fight COVID-19, but this virus can only be defeated by each and every South African's sense of duty and compassion. Only you have the power to stop COVID-19. The time has come for South Africans to make a choice: life or sickness and death. If we choose life, then we must realize that we have to make sacrifices during this festive season. It will not be possible to celebrate the holidays in the way we're accustomed to. We must now understand that the frivolities that are usually associated with the festive season must make way for things that really matter: family and friends, caring for one another, physical and spiritual rejuvenation, and preserving the spirit of Ubuntu. Excuse me. We therefore all need to take action to save lives and protect everyone. We must commit to small gatherings, responsible drinking, frequent sanitizing and washing of hands and surfaces, social distancing, and we must never compromise on the correct and consistent wearing of the masks. Universal health coverage is a social compact. It captures our collective consciousness as humanity that understands the importance of protecting one another. It recognizes that the right to quality of life is sacrosanct, and it acknowledges that everyone has to partner in their various capacities to ensure that no one is left behind. We have a role to play now in the fight against COVID-19 and into the future as we implement national health insurance in South Africa. As most of you know, in October, I signed my performance agreement with His Excellency President Cyril Ramaphosa. This agreement places at the top of its agenda the target of progressively implementing the national health insurance to achieve universal health coverage for at least 90% of all South Africans by 2030. This means that by 2030, in accordance to the World Health Organization's definition, we must ensure that at least 90% of South Africans, and I quote, have access to needed health services, including prevention, promotion, treatment, rehabilitation, and palliation of sufficient quality to be effective, whilst also ensuring that the use of these services does not expose the user to financial hardship, unquote. The preamble to the NHI bill, recognizing the socio-economic injustices, imbalances, and inequities of the past, the need to heal the divisions of the past and to establish a society based on democratic values, social justice, and fundamental human rights, and the need to improve the quality of life for all South Africans and to free the potential of each person. It subsequently joins us to achieve the progressive realization of the right to access to quality personal healthcare services by making progress towards achieving universal health coverage whilst ensuring financial protection from the cost of healthcare. The bill fundamentally sets out to achieve this by pooling public revenue in order to actively and strategically purchase healthcare services based on the principles of universality and social solidarity. This is what Professor Shisana has so eloquently elaborated upon, and of course, this has been also highlighted in the previous presentations. Fellow South Africans, the President has set out a very clear timelines for the progressive implementation of the NHI. Some of the key targets includes the following. One, that the NHI fund should be established as key entity and that it is operational by 2021-2022. That the fund should be purchasing services by 2022 to 2023, and that 25% of facilities must be fully certified to provide quality services at the standard expected under NHI by 2022, and that 100% of facilities must be certified by 2025. To support these noble and necessary ambitions, the agreement also sets clear directives and timelines for the implementation of the health market inquiry recommendations, as well as the pillars of the Presidential Health Compact. Collectively, these guiding documents provide us with the building blocks for a successful healthcare system that delivers on the promises of universal health coverage. Ladies and gentlemen, as South Africa, we've endeavored not to waste the proverbial good crisis as we sought to use the COVID-19 pandemic to inculcate elements of universal health coverage. I think the point was made quite eloquently, as I said, by Dr. Yates, that yes, we have a crisis, but in fact, we can build from that crisis for a better future. It is now well recognized that South Africa is one of those nations that has adopted and deployed a highly coordinated response to the onslaught of COVID-19. This is because for the first time in our history, we approached a public health crisis as one unit through pooling of resources. We paid special attention to strengthening primary care healthcare system through our community testing and screening campaigns and mobile testing units, amongst other strategies. While government led the response both financially and strategically, ultimately it was through the multi-sectoral working relations that successful expression of social compacting was achieved. The manifestations of which were high awareness of the disease, community mobilization and buy-in, active citizenship, and a government response based on evidence through high consultation with all key stakeholders. We're therefore feeling highly encouraged by the progress that has been made towards universal health coverage in this country, even as we face a significant pushback from the advent of COVID-19. Indeed, despite our gallant efforts not to be diverted from our path towards universal health coverage, the pandemic has made its impact felt. However, as government, we remain resolute not to shift goalposts and to stick to the plan for the sake of our people whose constitutional rights to quality of care can never be compromised. And Professor van Niekerk was very eloquent in describing how far back this issue of this constitutional right comes from, way back from the issues of the African claims during the times of leadership of Professor Alfred Batini Kuma, and then going on to the Freedom Charter, which also you will find that the spirit thereof is found in the preamble of our Constitution. So this is a right that is part of the struggle for which our people have fought for over many decades. I therefore wish to take this opportunity to join the global community in reaffirming the commitments that were made last year at the United Nations high-level meeting on universal health coverage in New York. This year, the state of commitment to universal health coverage synthesis has been launched by United Nations as an urgent call to action that political leaders must undertake to ensure that we do not deviate from the political declaration of the Universal Health Coverage 2019. Specifically, it calls on all the nations, and I quote, to prioritize universal health coverage to tackle and recover from COVID-19 pandemic, allay anxiety, and rebuild trust. Secondly, to address the systemic inequities that are widening with COVID-19 by creating stronger social and financial safety nets and prioritizing equity every step of the way. Thirdly, to expand and strengthen universal health coverage legislation and regulations, set clear targets and communicate better to bring people together. The next is to support, protect, and care for the health workers and innovate to improve and maintain quality during emergencies, and to invest in public health and primary health care as a joint effort of health and finance ministers and local government to ensure the continuity of essential health services and provide first-line defense against outbreaks, to build partnerships through genuine civil society engagement and empower women who are proving to be highly effective leaders in health emergencies, and lastly, to give universal health coverage principles more weight in every crisis response and build emergency preparedness into all the health systems. These are the commitments. We reaffirm, therefore, our commitment to these ideals and call on our peers in political leadership to work together with us to ensure the integrity and success of universal health coverage worldwide. And finally, we wish to acknowledge that there is no system without the dedication and workmanship of a capable and diligent workforce. I pay tribute to all healthcare workers who have shown a light of hope and excellence during one of the most challenging eras in the history of humanity. I want us to all take a moment and reflect on the lived experience of our healthcare workers who carried us through the first wave and without having rested or recovered, now find themselves in the midst of the second wave. And for many healthcare workers in many countries around the world, they've had to dig deep to find the strength to fight an emboldened enemy the second time around after a testing first battle. May I therefore request that we observe a moment of silence for the brave soldiers that we have lost along the way all around the world, our health workers. Moment of silence, please. Thank you very much. We thank all our healthcare workers for their bravery, commitment, passion, brilliance, and servitude. We are all in this together. We will protect one another and we will prevail over COVID-19 and any other insult that may come to meet us in the future. We will do this by ensuring that we build resilient healthcare systems through the rollout of universal health coverage across the globe. Here in this country, we look forward to continuing the parliamentary hearings as the nation deliberates on the details of the bill. We know that all South Africans want universal health coverage and that the NHI represents the hopes and dreams of the majority of South Africans who are achieving universal health coverage. As government, we are always ready to listen to our people as they express their desires and concerns regarding the bill. We continue to encourage citizens to use all opportunities to engage the bill and ensure that when it is ultimately assented into law, it fully expresses the will of the people. We know that universal health coverage through the implementation of our national health insurance is the best investment we can make for the people of our nation and for our economy. Ours is to invest in healthier populations for more vibrant economies. When we invest on universal health coverage, we must know it's a first step towards building a strong and a growing economy. Thank you very much.
Honorable Minister, yes, I join Dr. Yates in applauding you. Thank you very, very much for delivering that incredibly important message. And now what I'm going to do, Minister, with your permission, is I'm going to share my screen. And I've been looking through the participants, and I know that many of these participants were there with us last year on Universal Health Coverage Day. And I'm going to ask that our participants last year Now, here's what's happening is that we're going to unmute everybody. So while I'm sharing the screen, I'm going to just ask that everybody try to keep background noise. So what we will do is we are going to share.
Here.
What I'm going to ask is that
Sorry.
now, admin, please mute everybody for now. I've now unmuted myself. I'm going to share the pledge that that we, I suppose, inaugurated last year. I'm just struggling to share my screen at the moment. And then I'm going to ask that, oh dear. I'm going to ask that, there we go. I'm going to ask that the admin now, I hope everybody can see this pledge, and I'm going to ask that admin please now unmute everybody. We have about 133 participants in this call, so we would love to hear 133 voices reading Honorable Minister.
Saa hii siwezi jaribu, nikianzia saa hii na kesho ujue, lakini flight yako iko
Yeah, so ask some of the participants to please just follow the Minister of Health could read that we all read it together. Thank you, Minister.
Thank you.
Can't hear the minister.
Minister is muted. Minister, unmute.
Oh, I'm sorry. I thought we were all getting centrally unmuted. Could we then start? In the name of universal pledge to recognize and uphold the United Nations Sustainable Development Goals, in particular, the attainment of universal health coverage, to recognize and uphold United Nations high-level universal with South Africa realizing where universal health coverage is
Universal health. Right of health coverage. Every African citizen and child is enshrined in Section 27 of the
universal health coverage within
no one behind the universal health communities
operational means of
universal health
coverage.
Actively support the
support the
national health insurance bill, foster a culture of accountability,
national means of attaining universal health coverage in South Africa.
Thank you.
Thank you very, very much. This has a round of applause. And I know there was a lot of spirit behind some of those things.
Well done, everyone.
Thank you, Honorable Minister, participants. Thank you very much this wonderful engagement. Really, it was just really refreshing to come back and just realign our thoughts, come together with purpose, and get everybody once again focused on probably the most important revolution in South Africa. Honorable Minister, with your permission, this session may now be closed.
Thank you very much, and thanks for participating. Thank you very much.
Happy Christmas. Thank you.
Happy Christmas to you. Thank you very much.
Honorable.
Thank you.
Thank you.
Thank you from Sama. Bye.
Thank you, Dr. very much.
Thank you, everybody. Thank you, Lwazi.
Thank you.
Thank you all. Thank you, Lwazi.
Thank you. Thank you.
Thank you. Thank you.
Thank you.